Oh, hello there. How are you doing today? I'm good. You got an appointment today? All right. Is that with our hygienist or the surgeon? Okay. May I please have a name and a date of birth? Okay, so it actually says that you were a patient with us. Yes. Ain't you the one that got mad after the appointment and you came back and you cussed us out and said you was never coming back? Yeah, I guess your problems got a little worse, didn't they? Yeah, I understand. I mean, I wasn't too thrilled when I came here at first, but if you give us a chance, everything's gonna be okay. Okay, so now I will say this, because we haven't seen you in like 2 years, almost 2 years exact, we do have to have new x-rays just to see if the problems are still there, if they gotten better, if they gotten worse, you know, the whole shebang. But most of your information's on file. If you want to pick up the little tablet that's in right in front of you, just answer some basic questions, you know, like, are you taking any medications? Because we do sedate you. We don't use anesthesia because we don't really bring that out unless it's like really bad. But we do sedate you here. We just have our own method of doing that. That's gonna be okay though, right? Okay. And look on your tablet real quick and make sure that your insurance is still up to date, because I mean, if you don't have insurance, this is gonna be very expensive. And by expensive, this can be anywhere from $3,000 to $5,000, and maybe even more than that, depending on what we wind up having to do today. So I'm glad that you have dental insurance, because this would have been a very difficult process for all of us. Okay. The doctor will see you in just a second. If you would like to go sit out there, you can read a book, you can do anything. Just we'll call you when the doctor's ready to see you. Alrighty, so we do need to get the x-rays real quick so we can show the surgeon. Right now I got this phone here, and we have something like where we can send the picture directly to the machine instead of having to like get the machine out, because the machine is I don't know how to explain it. It's just broke. Yeah. So apparently somebody got really mad and they smashed it. So I'm gonna need you to open wide for me and let me take a quick picture. Let me take another one. Just open up really wide. Okay. Alrighty. Now I want you to go wait in that room right over there, and the doctor will be in about a few minutes and he'll see you. Oh, how are you today? Not so good. Yeah, I could tell by the look at your x-rays that you have some really bad cavities. Like, I don't even know what to call them anymore, but let's just say we are gonna have to remove some of your teeth today because the cavities got so infected. I'm actually surprised you didn't follow up with us when you were supposed to, but that's not really a us problem. You should have came in here sooner like you were supposed to. I understand that you wasn't completely satisfied before, but I'm gonna try to change your mind today, okay? So we are going to take care of that right now. The first thing that I want to do is I want to put some gloves on. And I want to administer you some medications for sedation, because we do not use anesthesia no more. Or basically we do, we can't use it for everybody because we run out really fast. Okay, so the very first medicine that I want to administer to you is this nighttime cold and flu relief. This takes care of minor aches and pains, headaches, sore throat. it's fever, runny nose, and all your little common cold and flu symptoms. And you can actually drink straight from the bottle, or you can just get, you know, a cup or whatever. And as far as pain relief, we did have to get rid of our Tylenol for reasons I don't need to go into, but no more Tylenol. Instead, we got Midol. I'm gonna administer this Midol to you. This is pretty much takes care of the same stuff that we just talked about. Let's see. Okay. Oh yeah. Cramps, bloating, fatigue, headache, backache. We're just gonna give you a double dose, and I'm just gonna go ahead and get this to you. And I'm gonna kind of explain the procedure while you're getting nice and comfortable. Yeah, go ahead and get an extra chug of that. You might need it. Okay, so I have this flashlight. I just want to take a quick look inside your mouth. Let me look inside. I wish I had a mask. I don't have no mask. Your breath kind of stinks. So I'm just gonna be honest now. I mean, you should have drank some water beforehand. I know they say don't have nothing 24 hours before surgery, but I say it's fine because I'm the one actually doing the procedure, not them. Okay, so what we're gonna do is, since we're against using like scalpels and stuff, and the only scalpel we have right now is being used on somebody else right now, what we're gonna do is we're actually going to drill the teeth. Like, we're gonna drill it down, and then, well, let me go from here. So yeah, this is technically a dog nail filer, but I promise you we didn't wash and sanitize it. So yeah, so basically we just turn it on, drill the teeth, and then when it gets down to it, don't have, like I said, our scalpel's being used. So what I'm gonna do is I'm gonna take a toothpick, and then I'm gonna set it on fire, and then it's like I'm gonna like kind of burn it, kind of sanitize it, and then like just kind of pick off the teeth. Worst case scenario, I can just file your gum down. If by any reason you wake up and you feel like excruciating pain, I can either give you some of the medicine I just gave you, kind of give you an extra dose, or I can send you to a guy that knows a guy in the parking lot. It's just, you know, they can't be legally, we cannot use their products in our medical business. So if you want that, you can always go to the back and get it, but you do that will be like a $100 upcharge, maybe more, and that's not even through us, it's going to be through them. So I hope this medication really works for you, and I say that you're comfortable. So all I want you to do is I want you to just like close your eyes and relax, and we will get started with this procedure. This is gonna be okay. I promise you're gonna be okay. Just lean back for me. Oops. that is one tooth that we got. That was actually a very tiny tooth. We got 3, maybe 4 more to go. Okay. Where's my pink? That's a hard one. Hang on. I might actually have to, since you're starting to bleed, I'm gonna actually have to burn your gum a little bit. So. Oops. Okay, let me try to dig this part out. I'm trying to squeeze it out with my fingers. Okay, hang on. There's a little piece that's still hanging on. There you go. Make your pick real quick. Usually I can just probably pull it out like this. Got it. Okay. But I just lost my pick. I need to go get a new pick. Hang on. Let's see. New pick. Okay. Open wide. This other one out. How are you feeling right now? Not good. Feel very bad. Yeah, you're actually bleeding some more, so let me just kind of burn. Try to cauterize the wound because we can't actually clean up the blood, so you're probably gonna need to just like wipe it off with like your hand or your clothes, or toilet paper. Like when we get done, you can go to the bathroom and kind of just wash it off, because I mean there's really nothing we can do about that right now. Yeah. But let me go ahead and take care of this last tooth for you, so I can get you your paperwork and you can be on your way. So let's just go ahead and get this last tooth. This one's gonna be difficult. This one's like a big tooth. Actually, I was able to get that one out pretty good. You're starting to bleed a little bit more. Okay. How are you feeling? Terrible. Well, you did just have like 4 teeth drilled out of your head. Well, technically 5, because it kind of, when I was drilling it, it kind of got another tooth to the side, so you actually just lost. Okay, so I accidentally got some extra teeth, so you just lost like 8 teeth. Well, look at the process. I pulled them for free. Think about that. I pulled them for free. Them extra teeth ain't even going to be on your charge. You're only getting charged for 4 teeth. So, honestly, you should be more grateful. Because people in here have to pay thousands of dollars just to have 1 tooth removed. And for them to have multiple teeth removed for free. Yeah. Be more grateful. Sweet relief. Oh, yeah. You're unsatisfied? Well, I mean, you can go to the front desk, you can make a complaint. We do have phone numbers out in the office. We legally have to. If y'all ask, we have to give you the number to our human resources. But just keep in mind, they're constantly getting calls about us, so they kind of just stopped caring at some point. They've done sent people here to spy on us, and they've seen nothing wrong, so they didn't do anything about it. Otherwise, we would have been shut down years ago. But other than that, I did my job, and I am going to quickly write out a prescription for some super strength medications for you. What's a good pharmacy for you? Okay. Alright, and how are your symptoms right now after surgery? That's not good. Okay, so maybe we might have to take you to the emergency room. It's gonna be about a $200 fee for us to call 911, and then it may be like an extra couple $100 on the ambulatory side to take you to the hospital. But I think that's what we're gonna have to do right now. So if you would just like lay back and relax, and here, take another Midol, and I'm gonna call an ambulance because I think you really need to go to the hospital. Like you're like bleeding and you're giving me all these symptoms. Yeah, that's not good. So here, take this, and better yet, take you another swig of some cold syrup, and let me go call 911.